What I also thought was awesome and timed perfectly is one of the viewers mentioned CISA, and then it just so happens that our next presenter happens to be coming from that area as well, talking about something I mentioned earlier, when I discussed healthcare. Healthcare's attack surface is just astronomically large, which means Nitin Natarajan is going to join us and his team and talk about really that threat landscape. So I am super happy to have you join us, Mr. Natarajan.
Hey, Rich. Hey, Stacey. Thanks for having me. It's a great time to talk about two of my favorite topics together, talking about cybersecurity and healthcare. Officially, I will say from CISA that I love all my sectors equally of the 16 critical infrastructure sectors, but I'd be lying if I didn't say I had a small piece of me near and dear to my heart that, you know, is concerned on the healthcare front. So I thought I'd spend a little bit of time just kind of talking about what we're seeing in the threat landscape and what we're doing with healthcare partners, and really leave some time open for questions and talk about any questions that folks may have about our work here and what we're doing. So, as mentioned, my name is Nitin Natarajan. I'm the deputy director here at CISA. I've been here for almost 4 years now, and I'm personally leading our healthcare efforts so that we can ensure that, again, give kind of the prioritization and the concerns that we're seeing out there. Because fundamentally, I mean, the issue of the cybersecurity in the healthcare space is a patient safety issue. And just mentioned with the attack surface changing, and growing exponentially in healthcare over the last 20 years, it's something that we need to really focus on. I think, and when we talk about healthcare, we're not just talking about hospitals. We're talking about the entire spectrum of healthcare and public health. So we're talking about medical manufacturing, distribution, supply, pharma labs, blood, biotech, health IT, insurers, payers, HMOs, that entire spectrum that's needed for that clinician to deliver care at the bedside. And the innovation of technology, I think, has been absolutely amazing in healthcare over the last couple of decades. But as we all know, with that comes the introduction of new vulnerabilities and risk. So, CISA looks at this obviously as if we were in person, I'd ask everyone who's familiar with CISA. I'm sure every single hand in the audience would go up. But we're really looking at our role as America's cyber defense agency, both on the federal civilian executive branch of government, but also as a national coordinator looking across 16 sectors. So if you look across all 16 sectors, we do see a lot of commonalities and concerns shared by not just the healthcare sector with others, and really looking at issues and programs that we can put in place to really leverage and build resilience and buy down risk across the board. Now, the health and public health sector is led by Health and Human Services. They serve as what we call the Sector Risk Management Agency, and they lead the efforts in the healthcare space. But, we provide a lot of support and collaboration with them to be able to work with state, local, tribal, territorial partners with the private sector to address risk. Because at the end of the day, this truly is about enterprise risk. I think, what we've been really pushing a lot of discussion on it is looking at this from the enterprise level, looking at this now from a risk level. And I see risk as a three-legged stool. I think we spend a lot of time on risk identification. We spend a lot of time on risk mitigation. We forget the third leg in that stool. And the third leg in that stool truly is risk acceptance, right? Any risk that we've identified and we can't mitigate or choose not to mitigate, we're accepting. And we need to really have these honest discussions about the risks that we're accepting in our organizations. We need to understand the risks that we're introducing and the vulnerabilities we're introducing. We're bringing in new technology, new capability, and those types of elements. And we need to elevate the level of that discussion to not reside purely within CISOs, the CISO community, but really have CEOs, boards of directors engaged in that conversation. At the end of the day, the CEOs and boards are making the investment decision. They're deciding that, the $5 we have are going here or going there. And we need to make sure that they understand the consequences of investment or lack of investment as we look into this. So we've been spending a lot of time with HHS across the country, having engagements with healthcare CEOs and CISOs and others to really talk through the need to look at this as an enterprise risk perspective, to look at this from a CEO and a board perspective, and really to be able to elevate those conversations across their enterprises. I will say, as I look at where we are today versus where we are 5, 10 years ago, I remember, in 2008, 2009, going out there to healthcare institutions talking about cybersecurity, and people looked at me like I was crazy. What are you worried about? Why are you having these conversations? What are we doing out there? And so I think what we're seeing today is I'm sitting on panels with healthcare CEOs that are talking to me about their attack surface. Right? 10 years ago, you never would have had a healthcare CEO use the words attack surface. Today, you're having them talk about attack surface and how they're managing and mitigating that. So I think we're seeing a change in the acceptance of cybersecurity being an integral part of healthcare. And I think now it's a question of how do we do this more effectively. And we need to do this because of the changes we're seeing really in that healthcare threat landscape. The thing that really concerns me about the healthcare sector and what we're seeing is this transition in the landscape, both in the adversaries and in the victim landscape. So if we talk about adversaries, predominantly, if we go back years, we're talking about, nation state threats, Russia, China, Iran, North Korea, and the concerns there. I think what we're seeing now is this pivot in the adversary landscape to also include cyber criminals and cyber terrorists, right? Groups that are utilizing ransomware and other tools purely for monetary gain. And I think when we look at that, that surface is changing of our adversaries. In addition to that, they were attacking entities that we never would have attacked. So if you think about healthcare and kinetic warfare going back centuries, we never bombed the tent with the Red Cross on it. We never hurt medics. We never went over hospitals. These were essentially considered entities that we would not touch. That's not the case anymore. We're seeing hospitals across the United States attacked, hospitals around the globe being attacked by ransomware, by actors all over the world. So, kind of that change in the adversary landscape is concerning. The change in the victim landscape is concerning. We're seeing attacks not only against healthcare, but against K through 12 schools in the heartland. We're seeing attacks against the food and ag sector, right? Entities that again, historically in the past have not been targeted. And if we layer on top of that, what we're seeing with Bull Typhoon, and really not seeing the activity that is not connected to the gathering and collection of intelligence, but really focus on the pre-positioning on our nation's critical infrastructure, for utilization at the time of their choosing, is also very concerning. So I think, as we look at where we are today, we're in a very dynamic threat picture from an adversary perspective, from the victim perspective. And we really need to look at how do we continue to move forward to address these threats. Ransomware obviously is a huge issue that we're looking at. I mean, I'm a firm believer. I continue to tell everybody I humanly can, you're never going to get $1 million via email. Nobody's ever going to send you an email resulting in $1 million, but people still click the link, right? And so we need to make sure that we're doing all that we can to protect ourselves from this. We have two key efforts underway here at CISA that we stood up last year in 2023 related to ransomware. One is our ransomware vulnerability warning pilot. We're able to notify individuals when we see that they have open vulnerabilities to known TTPs that we're seeing from ransomware actors. It's been extremely successful. We've made thousands of notifications to entities over the last couple of years. The other one I want to flag is our pre-ransomware notification initiative. The PRNI is slightly different in that we're not just seeing, potential vulnerability. We have information to show that an actor is essentially on your network, right? Essentially, they've delivered payload, but they haven't detonated. And so we have made thousands of these notifications over the last couple of years to entities around the country in collaboration with international partners and to really help entities that are on the verge of being encrypted. Now, the thing I want to flag is, and this is what's concerning the healthcare space, is that in 2023, we did over 1,200 notifications. Of those 1,200 notifications, over 10% were in the healthcare and public health sector. Over 10%, the largest number, were in the healthcare sector. So that was somewhat concerning and something that we want to continue to push on as we build resilience within the healthcare space. Because I'm from CISA, I can't go to a presentation and not talk about secure by design and secure by default and the efforts that we have underway to really work with industry partners to do that. Folks know we came out with our secure by design pledge earlier this year. We started with about 80 something signatories. We're up over 200 now of folks that have committed to really building software more secure, ensuring that as we make these decisions in organizations to implement new technology and capability, that what we're buying really is built with security up front, and that we're not looking at attacking security on the tail end. And I think we are starting to see some movement in this space. We're excited about the work we're going to see over the next couple of years and to see what industries can do with it. And this is not just a U.S. issue. This is a global issue. We talk to our partners all over the world, really kind of continuing to push this to make sure that we're integrating safe and secure technology into all that we do. I think in the healthcare space, this is even more critical because I think as you look at the amount of technology that we're introducing into healthcare systems as we look at some of the concentration risk, as we bring systems and elements together, as we look at the connectiveness of a lot of our systems in healthcare, it makes it even more critical to make sure that we have good visibility and understanding of what we're bringing into our organizations. And I think the work that is being done globally on secure by design, on software bill of materials and others are going to help CISOs have better visibility into making those decisions within their organizations. At the end of the day, a lot of this comes back to resilience. And how do we build resilience within the healthcare and public health sector? How do we build resilience at the organizational level? And how do we make sure that we're buying down risk at the end of it? And I think all too often in healthcare, what I hear is go place and go, well, we just go back to paper, right? It's not a big deal. If the systems go down, we go back to paper. But I can tell you, I was a clinician 20 years ago, before EHR, as EHR was kind of coming online, we all learned on paper. That's all we did. Learned on paper, and we had to get used to using computers. Today's generation of clinician was never trained on paper, right? Today's generation was trained on utilizing technology. So this concept that we can just go back to paper in the healthcare sector is not as simple as folks would make it out. And we have the same issue in other sectors, right? You look at the water sector with water operators and the ability to go back to manual operation. We see this across the board. But this concept of just reverting back to the way we used to do things was helpful when a majority of our workforce grew up that way and learned that way. That's not the case anymore. And so I think that we really need to think about how do we build resilience? How do we move back to paper? How do we build our plans effectively? How do we have strong plans of integration of cybersecurity incidents into our broader plans? I'll go to organizations and talk about their cyber response plan. And often what people will say is our CIO and our CISO are handling that. We don't have to worry about that. We're worried about natural disasters, mass casualties, those other types of issues. And realistically, again, these are enterprise risks, and we need to look at how we're going to respond to a cyber incident the same way we plan for how we're going to respond to a wildfire, to a tornado, to a hurricane, to a power outage, to these other types of risks that healthcare facilities are seeing. And to be able to have those plans in place, and frankly, to also exercise those plans effectively, to know that we're going to be, how they're going to do that. I think the challenge when we look at exercises and planning really is, again, diving deeper into that overall enterprise of response within the organization, bringing all parties together, looking at every aspect of that healthcare delivery system. This is even more critical in a rural healthcare system. It's one thing when you're in an urban area where you have the opportunity to go to a lot of different hospitals in a short amount of time. It's a very different perspective when you're looking at rural healthcare, where there may not be another hospital for an hour or more away, and being able to make sure that you're still able to deliver care, in these rural communities. So building resilience is something we're heavily focused on across all the sectors. It's something we're very focused on as we look at the healthcare sector itself. CISA really looked at a number of priority sectors in 23 and 24, and 4 came to the top of the list. And I should have started with this. 4 came to the top of the list: the water sector, looking at K through 12 schools, looking at election security, and healthcare. And so healthcare has been on our radar for a while now, but really a concerted focused effort here at CISA in 23 and 24, and we're continuing that as we go forward. Some of that is shown as we look at a lot of our toolkits and resources. We've worked very closely with HHS. We've worked closely with the Health Sector Coordinating Council, with industry partners to come up with a number of resources and tools that are out there for the healthcare community. We tried to put them all in one location. So we have a website, cisa.gov/healthcare, that speaks to, brings all the resources together, not just CISA's, but CISA's, the private sector, plus with HHS, to really be able to help healthcare institutions continue to build the resilience and buy down risk. One, obviously, we do have a vulnerability scanning capabilities. We'll look at our cyber hygiene scanning that we encourage organizations to sign up for. Free vulnerability scanning services that, a lot of organizations are using in addition to what they already have available commercially. So, I mean, one of the things that I like to remind folks, we're not a fee-for-service entity. I don't get paid for every enrollee we get into CIHI, but at the same time, we want to be able to provide a service to entities that either can afford capabilities, as we look at small rural hospitals, But also we actually see a lot of uptake of free services by large organizations as well that want to use our information to kind of either help validate or supplement what they're already getting. So we've been doing a big push in the healthcare sector for our Sci-High scanning. HHS did a great analysis recently on the hospital cyber resiliency landscape to really understand what they're seeing out in the healthcare space, what the key challenges are that at the institutional level, and put all that information together in a report that they published. I believe it was late last year or early this year. I have no sense of time anymore, so I apologize. But I want to say definitely sometime within the last year. They've also, HHS has put together with their sector coordinating council, so this is with their private sector partners, a cyber framework implementation guide as they look at how to best implement cyber efforts within the healthcare space. We have published within CISA what we're seeing in the healthcare space through our sector risk and vulnerability assessments. And then HHS has the entire 4 or 5D program, which looks at private sector engagement. And they're working to bring that closer with the Sector Risk Management Agency. And they're kind of coordinating their outreach and their engagement with the sector as it focuses on cybersecurity efforts. A couple final things I'll flag on, and then really again, I'll leave the time for Q&A that folks may have. One is our CISA regional team. So we encourage everybody to engage with our folks in the regions. If you've not had an opportunity to meet your CISA cybersecurity advisor in your community, I definitely encourage you to do so. All that information is up on our website. We have about 700 people throughout the country, people that are focused on physical security assessments, cybersecurity assessments, emergency communications, and election security. And so these are individuals in your communities that you have an opportunity to connect with that can help kind of be your gateway into CISA services. These would be the same individuals that will be reaching out to you in the event that we need to make a notification to your entity about being a potential victim of attack or seeing vulnerabilities. And they're also the entity that you can reach out to tap into CISA services. And also, if you are a victim of an incident, to kind of reach out and seek federal support. We are really working closely with our colleagues at the FBI and HHS and others to kind of be the one-stop shop. I know it's hard enough. I kind of joke, it's hard enough for those of us inside the Beltway to navigate the Beltway. It's even harder for those of you outside the Beltway to navigate the Beltway. So we really want to try to make it a one-stop shop where if you reach us, we can reach back. And similarly, if you reach out to the FBI, they can reach back out to us and really have those conversations. I appreciate the comment that popped up about the Sci-High reports. And, I do want to flag, we actually are modernizing that portal going into the fall. So we're excited to be transitioning from weekly reports to what will be a portal that individuals can go into and be able to pull their information at any time and really see kind of more robust reporting in addition to what we've been doing. So we're really excited about that modernization coming in the next several months. Hopefully current users will be happy with it. But as always, we welcome feedback. But again, I definitely encourage you to meet with your regional team if you've not had the opportunity to do so. Again, at the end of the day, the cybersecurity in the healthcare space is a patient safety issue. And we want to make sure that we are committing our resources, capabilities, and support both to HHS, but also to our state, local, tribal, territorial partners, the private sector, in all that we can do to help build resilience and buy down risk as we continue to tackle nation state threats, as well as threats from cyber criminals all over the globe, again, trying to impact the delivery of healthcare in the U.S. So with that, we'd love to open up for any questions and talk about any topics that folks would like to dive deeper into.
And let's see here. What was the first one I saw? Here's one. How has the new cyber incident reporting requirements affected CISA and healthcare clients? Any changes to the current process or procedures was one of them.
So on the CIRCIA legislation, so we haven't noticed a proposed rule out. So the rule is not final. So there's not any actual change in process as of now. I will offer that we definitely do encourage people to do voluntary reporting into CISA when incidents happen. And I want to spend a minute on this, right? I mean, I think people are often used to the government asking questions and collecting information, and it goes into some magical warehouse that the government has, right? It just kind of sits there and magical things happen and nothing ever comes out of it. Why is CISA so interested in incident reporting? And again, CIRCIA is not live yet, but from the voluntary perspective, it truly is to help, right? I mean, CISA, we're not the intelligence community. We're not law enforcement. We're not military. We literally are an agency. We're not a regulator. Like, we are an entity that wants to help, right? That help the victim. So what do we do when you report to us? Well, one of the first things we do is we offer our service and support, right? We have threat hunting teams and others that support, but really to understand the scope and scale of the, what are the resources you need? How do we connect you to the right people and the right resources of the federal government? How do we understand the impacts in the community that we want to help support? But we also want to really understand, what are the technical indicators you're seeing? What are the IOCs? What are the paths of attack? What information do you have that you can share with us on them? So what do we do with that? Well, we have the opportunity to bring that back to our teams and be able to help augment and support the incident response. If the organization has an IR firm, we can work with the IR firm as well, and really compare that against what we're seeing globally, right? What are we seeing kind of nationally? What are we seeing with our partners globally? How do we then work with the software or hardware manufacturer to really come up with mitigation or patches or what have you to do that? And then most importantly, not just return that back to you as the victim, but to be able to get that out to everybody else in the sector who may be that next. So our interest in voluntary reporting isn't just to put information in a warehouse somewhere. I've not found that magic warehouse yet, if it exists. It literally is to be able to give back to that victim and to the other sectors valuable information that they could use to protect themselves from a similar type of attack.
Very, very good. Stacey, do you have another question? I think you posted up there.
I did. So I had a question, and I wanted to comment on some of the other comments that we had about idealism and kind of harkening back to where we started. We started with talking about a breach and having hope and being idealistic. And I think that, with what is being described here, that CISA does help with those things. It helps with, here's how we can support a community. Here's how we can support these different businesses and keep people's information safe. And I mentioned earlier too, I'm a policy wonk, which means, I love talking about policy. It's the foundation of everything. And in terms of like CISA's recommendations, how does CISA recommend healthcare organizations balance compliance requirements like HIPAA with broader cybersecurity initiatives? That could be like following NIST, one of those publications, or even moving more towards zero trust architecture.
Yeah, I mean, so I'll say there's no magic bubble, right? Like, I kind of jokingly say, if there was a magic bubble we could put around ourselves, we could say that we're cyber secure. Everybody would buy that bubble around our organization. That doesn't exist. So I really see this as not a light switch. Right? We don't wake up one morning and we're cyber secure, right? We don't flip the switches. Yeah, it really is to me a bank of dimmer switches. It's dozens, if not hundreds, if not thousands of dimmer switches across our organizations that we really need to start thinking about each day when we come in. How do we raise at least one of those dimmer switches up? Right? How do we move towards better resilience? How do we move towards buying down risk by moving at least one of those dimmer switches up each day? And I think as you look at whether we're talking about NIST standards, whether you're talking about implementation of just basic cyber hygiene, right, and multi-factor authentication, and a lot of those other elements, as you look at working towards zero trust, as long as we're moving some of those dimmer switches up each, we're making progress in the right direction. We're never going to have resources to buy down all of our risks immediately. We can't implement technological solutions to a lot of this stuff overnight. But to me, it really is about looking at all of those elements in a way that allows us to strategically have a plan to continue to work towards that goal and that end state by moving those dimmer switches up each day within our organization. Again, for organizations that are smaller, that might be different, right? I mean, something as simple as going around your organization and ripping passwords off of keyboards, right? Like, that is a step in the right direction. You have moved that dimmer switch up a little bit just by ripping that password off the keyboard. So, I mean, things like that we can do to help move our organizations forward really are critical kind of across that spectrum.
Thank you. That was a really, really great response. So, and I'm kind of picking from some of the comments here too, because there's a comment that I really liked where someone had pointed out, it would be great if everyone had shared rules of engagement. And I do think that, when we talk about these different cybersecurity frameworks, it's kind of moving in that direction. So what is your take on something like that, of how we can implement more of those shared rules of engagement, shared frameworks that we're working from, so we can have some sort of unification or way that we're all following, not necessarily the same playbook, but ones that are similar or work more effectively across larger swaths of organizations?
So I think we're moving in the right direction. I think you see a lot more coordination and collaboration today than you saw 20 years, even 10 years ago in this space. And I think I'd offer kind of our products being a prime example. Rarely will you see a CISA product that is a CISA only product. A vast majority of products we put out there are CISA, FBI, NS. A lot of products we put out there are global, right? We're signing with our partners all over the globe and with private sector, with our sector core councils and other partners with ISACs. So I think we are starting to see more of that common approach. The Secure by Design document, that first one came out, had 12 or 13 signatories. We published an update less than 6 months later. We're up to 18 right, in 6 months. So I think we're starting to see more about coordination and collaboration, the consistent and common messaging. I will say that being said, there is a different lens on each of these, right? I mean, the regulators are going to have different requirements slightly than CISA would, which is slightly different than the law enforcement entity would, which is slightly different than what the intelligence community may be looking at. But I think we are trying to do what we can to speak with a common voice, to speak with a common message, while understanding that we each have a respective lane in this as well, to make sure that we're covering down on.
Crazy. I know I had a question. We were actually talking about it earlier in the comments when you brought it up, was this switch. And I was in Vegas, like I said, it was last week or the week before, and I was just talking to some of the people in there about how, if we go back a couple of years, like you'd mentioned, medical, anything was kind of off limits. Medical, childcare, like anything on that was just off limits. And now, as you had mentioned, it's kind of like a free for all. Do you know what maybe kind of made that switch? Like I said, there was a couple of comments with people, what they thought. What do you think kind of made that somebody flipped that switch and said, you know what, we're just going to kind of go after any and everything?
I think it's two things. I think money is a driver, right? It's profitable, right? I mean, if you really think about it, if you're an adversary, hospitals can't be down. There's a patient impact. There's impact to the community. The potential and the perception of a cyber criminal that a hospital would pay ransom is going to be high. So I think they see it as an ideal target from that perspective. I also think, and I've been saying this for a while, that hospitals really are one-stop shops when you think about it. When you think about the amount of information that resides within a single healthcare facility, for an adversary, they do become one-stop shops, right? You have everything from point of sale information to PII, to insurance information, like stuff like medical records. I mean, things across the board that could be leveraged by a cyber criminal in a lot of different ways. So they really are kind of that one-stop shop for somebody who wants to do bad things. So I think kind of that combination of people realizing and understanding what healthcare institutions actually have at their disposal, combined with the desired kind of impacts and so kind of societal discourse, is another element, and the fact that the money's there. Right? And I think that we're seeing, and this is where again our focus on ransomware is a prime example. If you look at if you wanted to become a cyber criminal, it used to be hard, right? You had to recruit people, you have to build infrastructure, you have to have a mechanism to remove the money. All these things have to be in place, and you have to find a victim and to go on an attack. Today, as we're seeing ransomware as a service, it's even easier, right? You don't need to build all of that. You need somebody that you want to have a victim, and you need crypto, and essentially, after it keeps the percentage off the top, and you go from there. So I think that kind of this combination of really people understanding the information and the value of attacking hospitals, combined with kind of this change and focus on money and ransomware, really is making it hospitals a much more palatable victim set, which is why we need to build more resilience and buy down risk within the healthcare.
It's wild. Yeah. That was one of my things. I think it's just in today's technology or in today's world, it's ease of access is now just a click away from everybody. Before it was more difficult to get involved. And as you mentioned, like ransomware as a service or just, malwares, everything's as a service now. If you hop on the dark web, you can just go through and work with CSMs for nefarious organizations to set up everything you need. You can just be an angry individual, kind of make bad things happen.
Yeah. I think that's kind of one of the underlying points is as we grow and things continue to change, a lot of these technologies do make it more accessible. I mean, you even think we're talking about, hey, in the past, this used to happen. Well, hey, in the past, whenever the internet was first a thing, it was primarily used by the military and academia, and then it became part of our everyday lives. And now it's so enmeshed in everything. So I completely agree. It's there are so many multifaceted things that cause all of this.
I mean, listen, if it were easy, it'd be done by now, right? I mean,
Sure.
it's a complex thing. And frankly, but I'll say we see this in all the sectors, right? I mean, we see this kind of in the influence of technology to pharma. As I talk to the food and ag sector, I've talked to companies that make pharma. The volume of code in a tractor these days is mind-boggling. So I think we're seeing a lot of this type of transition across all the sectors, and which is why it's important to continue to build that resilience.
Yeah. It wasn't, I don't know. I still don't have a smart fridge, for example. I think a regular, like, open the doors, it's fine. And I do think it's interesting, the more and more that we advance, the more we're adding like these network connectable devices to just literally everything. So,
And this is where I think, things like SBOM and stuff are important, right? I mean, like, I think it's great to introduce new technology, right? I mean, there's a lot of things that are much safer in healthcare today because of technology. The things that are easier, quicker, faster because of technology, right? So I think that those things are helpful, but we need more visibility and truly understanding the risks that we're introducing, or the ability of effectively make sure we're mitigating the risks that we're introducing bringing these systems into our institution. And we need the visibility to do that. We need to know what software, what hardware we're bringing out. We need to know how things are connected. We need to know what code's written in. And I think that we're seeing a lot on the medical device side, obviously with FDA, but we really need to look at that more broadly and let people make those better informed decisions. So I think that we're moving in the right direction, but it's going to take all of us to do it. It sounds corny, but the thing I always tell people is, you know, everybody has a role to play in this, and we need everybody to play their role. And so I think that we need to make sure we're pushing on all fronts.
thank you. Thank you for your time here today. I know we're running a little bit short on time. I'm going to put some information in the chat of how people can get connected with you and also how people can partner with CISA and collaborate.
And definitely. And again, if you've not talked to our regional teams, please reach out and have that engagement. We want to work with you. We want to learn from you. We want to share what we're learning. And it really takes a community of us. Appreciate the time and the opportunity to be here.
Yeah. Thank you so much.
Thank you.